if you're on Medicare or you have a parent or loved one on Medicare, there's a very good chance that over the last couple of months, if they're living with the disease of obesity, their ears have been heightened by this chatter of coverage for GLPs and for $50. There's been a lot of noise around this, but not a lot of signal. And that's what we've tried to bring you for the last couple of months since this was announced. And it's what we're going to do today because there has been some groundbreaking news in the last couple of days, releases of information by the Centers for Medicare Services. And we're going to get into all that and what it means for you so that by the end of this video, the end of this podcast, you're going to be pretty well versed in where things sit and how you can participate. That's what we're going to get into on this week's episode of the Weekly Dose Podcast. Welcome back.
Welcome to the On the Pen podcast with your host, Dave Knapp.
Welcome back to the Weekly Dose Podcast. I am your host, Dave Knapp, man on the Manjaro. That's why I am here, but you are on the pen. Wegovy, Saxenda, Victoza, Trulicity, Manjaro, Zepbound, Compound. That pen. It's what we talk about each and every week here at On the Pen, the Weekly Dose, and we couldn't talk about it without our partners at Shed. Listen, if you're somebody living with the chronic, relapsing, and multifactorial disease of obesity, and you have felt flat out shut out by your provider, look no further than our partners at Shed, because they'll connect you with a prescriber who can talk you through your medical history, your disease of obesity, and get you treated as an individual, not as a number. And they understand uniquely over at Shed that this is a very difficult disease to manage, and they can connect you with all the treatments and tools that you need along the way. So make sure you go to check out tryshed.com and use code OTP25 to save 25% off of your obesity treatment. That's a pretty big discount for OTP listeners. So check them out, tryshed.com, or you can find it in our links at our link tree by visiting otplinks.com. But if you have heard this over the last few months, Medicare is about to cover GLP-1 medications for $50. Again, a lot of people have just been confused by that because it didn't come with a lot of information around it initially. And so as little bits and dribbles of information have come out, we've attempted to bring that information to you. And we think we've got a pretty good rundown of where things sit today so that you can finish this video with confidence, knowing that this is how the system is going to work moving forward. So today I want to slow this whole thing down and help us understand really exactly what's happening, because there's actually two different federal programs going on right now with two different names, and they work in two different ways. And it's really important to understand the difference between the two and what that means for you as a patient. So these programs are called the Medicare GLP-1 Bridge Program and the balance model. And understanding the difference between these two things is key to really understanding what patient access is going to look like in the days, weeks, and months to come, and even years to come. So first, a little bit of context. Right now, Medicare does not cover obesity medications as a statutory benefit. That would actually require an act of Congress. We've been telling you for 3 years at On the Pen about the Treat and Reduce Obesity Act. This is a piece of legislation that's largely been championed by the Obesity Action Coalition. You can check them out at obesityaction.org and learn more about how you can support the passage of this bill, because that's a tremendously important piece of all this. So the federal government can't just flip a switch and add obesity drugs to Medicare. What they can do is run pilot programs that demonstrate models through the Center for Medicare Services. And that's exactly what happened when President Trump signed an executive order back a few months ago after negotiating with Eli Lilly and Novo Nordisk to try to control the cost of these medications. The federal government is using their demonstration authority to test whether GLP-1s for obesity can be covered at scale while also simultaneously controlling the cost. And that test is happening again in two phases: the Bridge program in 2026, this year, and the balance model beginning in 2027. So let's talk about the Bridge model, because that's the one that affects us the soonest. if you're just tuning in here, this is the Weekly Dose podcast. And my biggest ask of you is that you would hit the thumbs up button and hit the hype button below on the YouTube video. If you can't find it, hit the description and then there's a hype button. Hit that so that more people can see this video, because this is super important information. All your likes, comments, and subscribes are super important, but especially that hype button right now. Let's try to get onto the trending list for YouTube. So this program, the Bridge model, will run from July 1st of this year all the way through the end of December. So July 1st of 2026 through December 31st of 2026, we get the Medicare Bridge model. And it's essentially a temporary access program that's designed to give Medicare patients early access to obesity medications before this larger balance model comes into play. Now, the most important thing to understand about the Bridge model is that it doesn't run through insurance companies like the balance model will. The most important thing to understand is that normally when a Medicare patient gets a prescription drug, the approval request goes through their Part D insurance plan. That will not happen at all with the Bridge program. Instead, the federal government's going to use a central processor that will handle all the prior authorizations, all the claims processing, and payments directly to pharmacies. Now, your doctor submits that request to the central processor, not your insurance plan. So that's an interesting way about how this will work in terms of prior authorization. So you'll get that from this central processor. And that's a major reason why this plan can go into effect in July and not 2027, when all the new plans will come out, because this was enacted late in the year last year before this could get added to Medicare plans. So insurance companies are essentially removed from the financial risk at all during this Bridge program that again takes place from July of this year until the end of December of this year. Now, what will patients pay under this first Bridge model? That's what everybody wants to know, right? How much is it going to cost? You probably heard the figure of $50. We've talked about it here on the pen. Under the Bridge program, the pharmacies will collect a $50 copay from the patients who qualify. Behind the scenes, the government, basically as a quid pro quo to open up Medicare markets to these medications, negotiated the costs using the Inflation Reduction Act passed during the Biden administration to reduce the cost of these medications in negotiations. So basically what you had here is these companies coming to the table and agreeing that they were going to supply the price to these plans for $245 a month, these GLP-1 medications for obesity. So that's Lilly and Novo. And the rest of that cost is going to be handled by the demonstration program. So you take the $245 cost to the government, your $50 copay, and this program is paying the difference. So for eligible patients, the expected out-of-pocket cost initially is $50. However, there is important nuance that people really need to understand here. When the larger balance model takes place in 2027, some Medicare plans will still have prescription deductibles that you'll have to meet. So that means certain beneficiaries in 2027 may pay around $245 a month until they meet that deductible. And after that, their costs will drop to roughly $50 a month. Now, that might be still too expensive, but when you consider the cash pay price for Zepbound in the upper doses right now is still $450. Well, it's a lot cheaper, and your other options, aren't super great in terms of GLP-1s at lower costs than that. So while that's still a little bit high, you're still getting the benefit of that negotiated cost, where they negotiated the cost of these medications down from their list price, which was over $1,000. So the $50 figure is very real for this Bridge program, but depending on someone's plan for next year during the balance program, it may not apply on day one. I think that's just an important thing to understand right away. If you have a question, please drop it in the comments of this video, and I'll try to respond to those questions as they come in. So what drugs are included? We talked about how Lilly and Novo were the ones that came to the table on this for the GLP-1s. They're the only ones with GLP-1s currently for obesity. So at launch, it will include Zepbound from Eli Lilly and Wegovy from Novo Nordisk. So you're going to have Zepbound and Wegovy, and you're going to have orforglipron from Eli Lilly available too once that is actually ultimately approved by the FDA. So both of these are FDA approved medications for obesity, and then you'll see more added along the way as they're approved. But right now, these are the ones that have been named in the guidance from the Center for Medicare Services. So let's talk about who qualifies, because this has probably been one of the largest questions around this whole thing that hasn't been cleanly answered. And it still leaves some questions, especially for those in maintenance. And I hope that we can get answers for that. I know that they're working on that at the Obesity Action Coalition. So as soon as we have guidance on that, we'll bring it to you. Follow along and make sure you go to otplinks.com and go to our Substack. You can actually just type into your browser obesity.news and go to our Substack. Sign up for our newsletter, because we have been giving information about this, gold nuggets about this, as it comes out. And you want to make sure you get that in your inbox and don't rely on a YouTube algorithm to feed you a video randomly where you can learn about this. Go sign up for our newsletter at obesity.news. But here's the qualifying criteria right now. You need to be enrolled in a Medicare Part D prescription drug coverage plan. And then obviously you have to be 18 or older. Obviously, most of the folks on Part D are going to be folks that are of senior citizen age. Then eligibility is based on BMI and health conditions. So patients will qualify if they meet one of the following categories. One, you have a BMI of 35 or higher. 35 or higher is the cutoff. You don't need any additional health conditions. Now, BMI of 30 or higher with certain health conditions, including heart failure with preserved ejection fraction, uncontrolled hypertension despite treatment, or chronic kidney disease stage 3 or higher. And then it goes down to a BMI of 27 or higher with cardiovascular risk conditions. And this is the most important one, including prediabetes. So many folks who are up there with the BMI are qualified based upon the prediabetes alone. So prior heart attack, prior stroke will also be included, or symptomatic peripheral artery disease. So in addition to meeting these criteria, patients must also be prescribed the medication for weight reduction and long-term maintenance alongside lifestyle changes such as diet and physical activity. So there are some lifestyle requirements in terms of the actual prescribing of the medication. So how do you actually get access to this? Practically speaking, what are the steps? Another thing that has confused people about this whole program is how someone actually enrolls in it. So patients do not apply directly. This is not somewhere where you'll go, hey, I want to sign up for the Bridge program. The Bridge program, again, the one that takes place this year. There's really nothing you need to sign up for. Everything's going to start with your physician. So your doctor has to prescribe the medication, again, for the things that we just outlaid over the last couple of minutes, and submit a prior authorization request to the CMS central processor. As soon as we have instructions on how to do that, we're going to bring them to you at our obesity.news Substack newsletter. Sign up today. That processor verifies eligibility and then authorizes the pharmacy claim. So the practical takeaway is pretty simple here. If you believe that you qualify, the first step is having a conversation with your doctor about BMI, about metabolic health conditions, and whether a GLP-1 is medically necessary or clinically appropriate for you. And then it's going to come down to those clinical criteria that we outlaid a couple minutes ago. And your doctor will submit a prior authorization to this new CMS central processor. Again, we'll have directions on probably how to do that over at our Substack. So what happens after this program? Because it sounds like the vast majority of folks will get access to these medications in 2026. But what happens in 2027? The landscape really changes, because that's when this real larger experiment to tell whether this model can be maintained over long term begins, because it brings the insurance companies back into the equation. So unlike the Bridge program, Balance, which starts January 1, does involve the insurance plans. So Part D plans will have to apply to be a part of it and be approved to be in the model. Now, what we have heard is that these insurance companies will be encouraged strongly to participate. So take that for what it's worth. That's what we're hearing in the industry chatter, that it's going to be highly unlikely that you see too many plans not participating here because there's going to be, I believe, some political strong arming involved. I don't know. That's just what I'm hearing behind the scenes. But manufacturers must also agree to participate under the negotiated pricing. So you have to have Lilly and Novo on board here to offer at these discounted rates. Now, if a patient plan decides to participate, GLP-1 medications could become a part of the prescription drug coverage under this new model. So you'll have to select a plan that participates in the fall. And again, we'll help guide you through all of that as well. Patients who start therapy during the bridge program in 2026 will need to enroll in a participating Part D plan in 2027 in order to maintain access. So that is hugely, hugely important. And we will, again, bring you all that information as it comes out. So now this participation in the balance model by these insurance company is technically voluntary. That is what it says on paper. So what I'm saying is happening behind the scenes and what is being said is just speculation. On paper, the CMS is saying it's voluntary. So during the bridge period, insurance companies are not financially responsible for these drugs, but next year they will be. So during the balance model, pricing negotiations and program design are intended to make coverage manageable from a cost perspective, because again, they're testing this model to see if it's a financially viable plan moving forward down the line. So while plans may not be legally required to participate, many observers do expect broad participation once it launches. In fact, Eli Lilly has said they expect 100% participation. Novo has said something similar. Novo has said they expect to gain 15 million customers from this. So I think it will be a wide benefit. And I think that it will end up covering most people appropriately. So the key dates to remember here, moving forward into the next few months here, are July 1st. That's the first big date that matters to you, because that's when the Medicare GLP-1 bridge program begins. That will be when coverage starts to begin. You can go to your doctor. Your doctor can submit that prior authorization to the central processing for CMS. And then that program ends, as we've described it, at the end of December 31st of 2026. January 1 is when the balance model launches for Medicare Part D plans. You will have to have enrolled in a participating plan in the fall to maintain access in 2027. And those dates essentially define the transition from the early access period of 2026 and the bridge model to the balance model of 2027, which is the larger federal government coverage experiment that they're running through CMS. So I know that was a lot of information to take, and I know there are still questions, but I think this brings the most clarity that we've had to this to date. The big questions for me hanging out are, will this cover folks in maintenance? How will they communicate which plans are covered and which won't be? And how will you be able to predict your cost based upon your specific plan and the deductibles and all of that? Because again, not everyone will be able to get the medication for $50 right off the bat in 2027. 2026, you're covered. 2027, probably a different story. And so we've got the bridge model getting us to the balance model in 2027. And the results of these programs are going to determine coverage over the long term, because this is only a couple year program, at which point we have got to get this codified into legislation. It's very important that we get the Treat and Reduce Obesity Act passed. Please go to obesityaction.org and learn how you can support the OAC in their efforts to get this legislation passed. Of course, they'll be amending the legislation over time to work and jive with this program. And hopefully at the end of the day, we see this codified long-term, because the last thing we want is Medicare patients yo-yoing on these medications because of coverage issues. So if you are someone on Medicare, or you care about someone who's on Medicare, please share this video with them, because this is probably the most comprehensive and clear and up-to-date update that there is on the internet. Check out obesity.news and sign up for our newsletter. All you have to do is put your email in, and you'll get updates directly to your inbox. That is going to be the best way to stay in touch with all the updates about Medicare. And as things continue to evolve, we will keep you updated right here at On the Pen. Thank you for being here today, and thank you for being the best part of what we do at OTP. I couldn't, wouldn't, and shouldn't do it without you. and we will catch you on the next one.